My name is Ann Kozek. I'm one of the 4 dietitians here at Lurie. I've been here for 3 years, but I've been in the world of metabolics and genetics for a long time. I also did a couple of about 15 years in early intervention, which is where I was trained to become a feeding therapist. So there will be a slide in here talking about feeding therapy because that's one of my loves as well. So just to go back for a minute, before I actually start, I have to, unfortunately, Brooke, one of our other dietitians, has left for the day, but I have to throw out big kudos to her because my slides look the way they look because of her. My strong points are playing with babies and food, not technology. So she played a big role in helping me have nice slides for you to look at versus just a bunch of words on a screen. So just to take a step back to the doctor's presentation, which was a long time ago this morning, just to touch quickly on the difference between MMA and PA and the enzymes that are deficient. So in methylmalonic aciduria, acidemia, same words. The enzyme that's deficient is the methylmalonyl-CoA mutase, and in PA, it's the propionyl-CoA carboxylase. And you can see these are all really big words, hence why we call them MMA and PA. So much easier to say. Now, both of these enzymes break down what we call the propiogenic amino acids, and I'll get into amino acids in a second. But the propiogenic amino acids are valine, methionine, isoleucine, and threonine, which explains then why the word vomit is written on the bottom of the screen here. It helps us remember which amino acids we're working with because valine, methionine, isoleucine, they spell vomit pretty much. The O in there is the odd chain fatty acids, but we don't usually talk a whole lot with the families about that. We just watch it in the diet. The big thing to monitor are the amino acids. And we know when they're not treated, there's the buildup of the toxic substances, methylmalonic acid, propionic acid, depending on which disease state we're talking about. So enzymes, what's their job? Their job is to break down protein to amino acids. There's 20 different amino acids that build up protein. Again, in these conditions, we're looking at valine, methionine, isoleucine, and threonine. So you can see, and I don't have a pointer here, which makes me nuts, but on the top left of the screen, there's the protein from foods. So we eat those, chew them up, swallow them. Enzymes in our body break down the proteins to the 20 different amino acids. Another way the body can get the amino acids is if we're what we call a state called catabolism. Your body needs nutrition. If we haven't given it, then your body still needs it, and it breaks down its muscles and tissues, which then release those for all the 20 amino acids. But by releasing the 4 that we're focused on here, we'll raise that in the bloodstream, which then, as you can see, without the enzyme, they can't go on to their respective pathways. These 4 amino acids go in alternate pathways to make the acids and the toxins that build up, which then lead to all the issues. So our goal with the diet is to minimize how much of these amino acids are in the diet so that we don't get too many acids and toxins built up. We still have to give some of these amino acids so that we have optimal growth and development. We can't take them out completely because then we'll have, amino acid deficiencies, which can lead to other issues. So that's why there's always like a small amount of when they're babies, breast milk, formula, cow's milk, in there to make sure you get these amino acids in just the right dose. And then as the child gets bigger, if they start eating more, we take that regular formula milk out of the medical formula and then they eat it in their diet. If we don't treat MMA, PA, the toxic substances, the propionic acid and the methylmalonic acid in both disease states, it affects the brain. In MMA, it can affect the kidney, heart, pancreas, and eyes. So that's, again, the goal is to keep the toxic substances at bay. The treatment for both of them is similar. The big thing is always modifying the diet, along with some medications. There's always the special medical formula, and then there's regular clinic visits along with blood monitoring. We like, the clinic visits is so we can measure growth, make sure that they're growing the way we would expect them to grow. Again, then it means we're giving them what they need in their diet. If their growth isn't where we need it to be, if we see in the amino acid levels or the other acid levels that they're all askew, then we know we have to modify the diet and either take out some of the regular formula, give more medical formula. So the goal ultimately, again, is to maintain all the plasma amino acid levels within the normal ranges, and then to achieve optimal growth and development for every individual. This slide just shows some of the medications that, the doctors had talked about earlier, and you've heard of carnitine, which is a scavenger, helps to pick up the toxic substances and excrete it in the body. Carbaglu, which again helps to keep the ammonia levels lower. And then some of the, if there's some enzyme activity, like we could give hydroxycobalamin, which is a vitamin B12 supplement, or biotin. Those are like cofactors that can help the enzyme work a little bit better to just help, again, process the foods. So everyone needs protein. No matter if you have a genetic disorder, if you don't have a genetic disorder, we all need protein to be healthy and to stay in a good metabolic state. In MMA and PA, most of the protein is provided by like the medical formulas. So when we're looking at diet, we just, again, calculate how much of the amino acids you need, or another thing we'll call it is intact protein. So it's the protein we get from foods, and we figure out how much is needed from the regular foods formula, and then we make it up with the medical formulas. So the medical formulas have little to no valine, methionine, isoleucine, threonine added to them. They also have a lot of vitamins and minerals added, and why that is important is you can see here, like I've just highlighted a few of the vitamins and minerals that we focus on, because underneath each of them, it shows you what is their food that they're so good, the best source of them. You can see it's all fish, dairy, meats, legumes, all the things that are very minimal in the MMA-PA diet. So by not eating those foods, you can be at increased risk for a vitamin B12 deficiency. And that's important because for red blood cell function and neurological function. We all know we need calcium and vitamin D for strong teeth and bones. Calcium also helps with muscle contraction. So by not eating those foods, we have to supplement them in the diet. And that's where another important role is for the formulas, is they have superdoses of these vitamins in there, as well as all the other amino acids to help maintain metabolic control in the body. If we don't get adequate protein, we get the results of high ammonia levels. There could be poor growth, weakened immune system, and just overall just very tired and kind of poopy feeling. So I thought you might just want to know, it's like, well, how do we dietitians actually kind of come up with your formula recipe? Do we just kind of go, this is a good one? Because it's not as simple as if you think about like the regular formulas. It's like, take a scoop of powder and add 2 ounces of water. There's a lot that goes into figuring out what is needed in a recipe. Again, we look at the individual's growth. Are they growing fast? Are they tall enough? Are they gaining too much weight? Are they not gaining enough weight? We also look at like lab values. So that's why the blood draws are important. We look at, all the amino acid levels, the vitamin levels, to help determine what exactly do we need to put in the diet. So again, we start then with, okay, We have charts and graphs that, are always a good place to start, especially with our babies who we don't know anything about and what their metabolism is. As we get to know you a little bit better, we can kind of predict what you might need, and the diets are so fine-tuned for everybody because everybody's metabolism is different that, the charts are a nice place to start, but we usually don't always stick to them completely because, again, it's based on growth and lab values. But we'll always look at how much do we have to give from the intact protein? Is it going to be the foods they eat? Is it breast milk? Is it formula? Is it another formula that we have to use? And then we go and we figure out the metabolic formula and how much do we need for, the Animex early years or a maximum product. Once we get those two figured out, sometimes we're still really short on calories. So some of you might know about like PFD2 or PFD toddler, Pro-Free, DuoCal. Those are just calorie supplements, and we have to throw those in there to make sure we have enough calories. If we don't have enough calories, if we don't have enough protein, then we're going to have the child in a catabolic state, which then they break down their tissues, which then releases all those amino acids, and we make our toxic substances. So it's, like I said, there's just a lot involved, and I just thought maybe you might be interested to know how much is really number crunched in making formula recipes. It's just doesn't happen, but it is fun to do. Now, the other thing you might hear from us all the time, what you probably do all the time, is like, you have to take your formula all through the day. Well, why? Why can't I just take a big swig and be done with it? Your body needs nutrition all day long. If we don't give it to it, the body's still like, I still have, functions I need to do here. Where am I going to get my nutrition? It goes to our muscles and our tissues. Again, like I said before, break down that, you release all the amino acids, and the cycle just continues. Whereas if we take formula all through the day, you're feeding your body the nutrition it needs. It helps to keep that metabolic control stable. So if you just take a big swig, it's going to use what it needs at that point in time, and the rest of it then is going to be just lost in the urine. So I just put this up for alternate feeding ways. Most of our patients here have G-tubes, and that's not to say like that they can't eat by mouth. We're all about, if you can eat by mouth, we want you to eat by mouth, but we know in MMA and PA, sometimes there's a strong oral aversion, and some of that was created when we go back to the first days and everybody's in crises and we're putting tubes down noses and we have tape on faces and there's just all this stuff going on. Or there's a lot of vomiting going on. So in the feeding therapy world, those are all called negative feeding experiences. And for every one negative feeding experience, it takes about 90 positives to overcome that one negative. So we want you to feed by mouth as long as you can. But if for some reason, say if you need to get 4 ounces in, little Susie only wants to take 2 or 3, great. Let them PO, as we call, feed by mouth, the 2 or 3 ounces, put the rest through the G-tube. This way, you're not stressed because you're trying to make, well, you have to get this 4 ounces in because we give you this prescription and we're like, okay, you need to give your child this much and they need to get all of it in every day. So we've already kind of laid that groundwork, which is a stress because it's in the back of your mind. And then if they don't want to take that, you're like, well, now you're forcing, again, another negative feeding experience. You're stressed, baby's stressed. It's a disaster. So G-tubes are just kind of like a cushion to make sure that you can then get in all the formula that's prescribed to maintain that metabolic control. I put the other picture up here, so like the TPN, PPN, and the IV fluids. Again, if you come in crises, you've probably seen some of the, we always put an IV in right away because we have to get high levels of dextrose in. Sometimes we have to throw lipids on. If they're in crises, we just have to flood the body with calories to push those toxins out. If we can't start protein within like 36, 42 hours, excuse me, we go to TPN so we can give some protein, because if we are just giving calories via dextrose and fat for a long period of time without protein, then we become protein catabolic. And, you know, there's my usual cycle that I just keep going on all day about. The diet is, you know, I've talked about there's a special medical formula. We limit high protein foods, and that's all the meats. So, you know, beef, chicken, pork, turkey, eggs, nuts, legumes, all the dairy, everything, that's all high protein. But there are a lot of special low protein foods that have come out over the years to help make the diet much better than it was 30 years ago, when we had a few pastas and bread that came in a can that was white and cookies that were really hard. So they are working to improve it. What we mean by when we talk about like a low protein food, it's actually a food that has less than 1 gram of protein per serving compared to other, you know, foods that we get at the store. So I just put up here a few examples. Like there's a bread machine mix, there's baking mixes, there's the special pasta. But just even from your regular grocery store, like all the fruits and vegetables are low protein. There's a lot of gluten-free foods, that are lower in protein. And now there's even more like vegan foods that are available that can be lower in protein. You just need to read their labels, but it's nice to have those options. You don't have to buy just always all the specially produced stuff. I put this up just to show you an example of the differences. Like there's the vegan gourmet cheese and there's the regular cheese. So you can see like the vegan cheese, a quarter cup is 0.2 grams of protein versus the regular, which is 7. 7 grams of protein, you're done for the day. You know, that's from food. It's too much. And a quarter cup of cheese isn't going to fill anybody up. And the vegan cheeses have really come a long way in 30 years. They actually melt now, and they actually like have a mouthfeel and taste much better than they did before. The other thing I like about some of those is like they're easy to find. They're more reasonable to buy. And I don't know if you've seen out there on Danae's table, there's this book, 1, 2, 3, Let's Eat, which is just all like lower protein foods that you can find in the grocery store. I'd say if your child is in feeding therapy, I would grab one of those, share them with your feeding therapist, because we're always looking for ideas of what can we work with for feeding therapy. You know, and you don't want to necessarily play with, you know, pasta that was $8 a box, you know, or a loaf of bread that was like $12 a loaf. Yeah, and most likely they're not going to eat it anyways, even though the ultimate goal is to get to look like this baby here in this picture, those make the best pictures. And when a baby's allowed to do this, they actually become better eaters. So I'm all about, as much as it's a mess and a pain in the neck to clean it up, it's really what's needed to make good eaters and to help overcome oral aversions. Some of the tools that I've put up here are just tools that we've used in feeding therapy just to give you ideas to help overcome oral aversions. There's the Nook brush on the far side. The bumps on the ends help to provide some stimulation in the mouth, and some babies like that. You can even just start rolling it on the outside just to help, again, get close to the mouth. There's always like the fingertip toothbrushes. If they don't like that, you can just use like a baby washcloth that's wet. And even if your child doesn't eat, it's still very important to brush their teeth just to keep good dental health going, because when the day comes that they eat, you don't want bad teeth, because then they won't eat because their teeth will hurt. There's these raspberry Nook things, pacifiers. Right next to the baby, there's the maroon spoon. What's nice about that spoon, with the speech therapist like, is the bowl in it is flat. So it's easy for somebody with like weaker muscles to like clean it off to feel successful. You know, if the baby feels like it's too much, or anybody, you know, I'm sorry, I just keep saying baby, but I mean anybody. If it's too much work to eat and they're not successful, they're not going to do it. So I'm all about, we got to make it pleasant and fun and let them know that it's safe. There's these cute little fun animals on the bottom. They're jigglers. They vibrate. Again, they can put input, like even if you have to start here, it's all about sensory. When they don't eat foods, a lot of it's just sensory play. And like feeding therapists, speech therapists, occupational therapists are all key in that. Don't want to not acknowledge the physical therapists because they're just as important, because if we don't have strong core muscles, we can't chew. So you have one physical therapist, so if you have to be able to go like this in order to chew. If you can't twist your body that well, then you can't chew. It's all about the rotary chew. I was like, okay, wow. And then like on the bottom, there's the chewy tubes, and then I have like those big things that look kind of like a ring base. Those are just teethers. What's nice about all of those with the arms is they go to the side of the mouth when you put them in, and what that does is it makes the tongue go to the side, so they can start learning tongue lateralization, which again is needed for chewing. I'll stop on that because I could go on forever with feeding therapy. And there's a ton of like other supplies out there, but it's just, these are just simple, and I mean, all of these are on Amazon. The one last thing I just wanted to touch upon too is, we dietitians, it's not like when we ask some of these questions or we ask you to tell us things, like it's not that we want to be part of your everyday personal life. However, if we know ahead of time, like you're going for vaccines, if there's going to be a dental procedure, if there's any kind of maybe like somebody in the house is sick and the first signs of an illness, like just to give us a call, because a lot of times we can just tweak things at home a little bit with the recipes, cut some protein, give some more calories, keep you at home. We love you. We want to see you. We don't want to see you in the hospital. Not personal. But sometimes that's all it is in some of these. It's just we can make these little tweaks. I mean, some of our kiddos have just step-by-steps, or there is like we call them, we just do the sick day. Vaccines, we know, make the body go into a catabolic state. No matter, I mean, those are little people, those are big people, when they get ready to go off to college and that, there's vaccines. Like, just let your team know so those adjustments can be made, but I also, there's life. You forget, I forgot to call that. I'm like, yeah, we're going to the pediatrician, It is, but if you start seeing like increased sleepiness, more vomiting, poor coordination, those are the signs that there's like a metabolic crisis that could be brewing. Call right away, go to the ED. The sooner you act, the better we can start getting things back under control and hopefully prevent like a major decompensation. And on that, I would just like to say thank you for listening. Like I said, I wanted to leave it so we could talk. If anybody has any tips about feeding, if you want to ask questions, please, let's. Food, anything, any other of our maybe dietitian secrets? I wondered how do they do that?
So I was doing a lot of research on how the EU doesn't allow for a lot of artificial foods like that, like powdered milk and other things. So would you say if someone lived in Europe or was going to Europe, would your recommendations like change per se? And how would you do a lot of the things that you're talking about, like supplementing a lot of artificial / powdered foods in a place like Europe, if that makes sense? Out of course. No, like she was talking a lot about like in grocery stores, you said you could buy like powdered supplemental foods, and I know those are not available in like other countries like Germany and stuff like that because they don't allow for a lot of powdered things. So.
Oh, just go to protein food.
Yeah. Oh.
So like on the food label, and it says this in this book, I read it through that like the FDA by law, if it's like 0.4 grams or lower, they can write 0. And 0 grams of protein, which for us doesn't matter.
Right.
But if you have a metabolic disorder and you're counting a gram of protein, that's a big deal. And like same with like what it's like 1 gram, it might only have some top, but it's still like fluid, right?
Right. Yeah.
So
Right. Yeah.
So, you know, it might be specific foods I don't know about, but there's, I think they're labeled for that.
Right. So should we just look for European labels for everything? Yeah.
That would go there and find it, and it's even some of the oh, yeah, once in a while you'll find it here.
I, th- um, I think if anybody has ever been to Aldi's, they'll know that that is a German-based grocery store, and a lot of the products that they actually have in the U.S. are from the EU. So that might be an option to explore.
Again, like, I can put it out there, so if you're doing feeding therapy, you, so Lurie maybe, you know, $2 box of toxins rather than an $8.
You're pretty loud, though. She just doesn't want to walk around anymore with the microphone. Yes.
Always these microphones.
Go ahead.
Just wondering. So I have two kids. They both eat by mouth, and we're like kind of meticulous about counting their proteins. And then we get a lot of packages that say like less than 1. But is there some kind of secret to how much less than 1 you can eat before that actually equals up to 1? You know, like if, let's just say 2 Oreos is less than 1 protein, but now you've just eaten a bag of Oreos, you have to eventually count it as something.
And that's too, like we get into, with a lot of it, we do the simplified diet now. So like there's certain foods that they're lower, they would be free. But yes, ultimately you're gonna, if you eat enough, it's going to count. So you can break it all down and see exactly how much protein is really in there. So a gram of protein is 4 calories. A gram of fat is 9, a gram of carbs. So you could like do all the math and divvy up, like it'll say like, you know, say 80 calories. And then you can divide all that out and you can figure out how many grams of protein are in there. It's a lot. It's being
I
too
wasn't
nuts.
looking to do that.
That's job security for me.
All right, we got you then. Okay.
You know, but you know, if you, so what you could easily do, if it said less than 1 gram, okay, simple ballpark. Say then, to be safe, it's a 1/2 gram of protein per serving, okay? So if there's 4 servings in that package and they ate the whole thing, then we're at 2 grams of protein.
Gotcha.
Basic ballpark, you're, just to be on the safe side.
Yeah, that's kind of what we do. So that
Right.
makes me feel better.
And if it's less than a gram, it's probably about a 1/2 gram, you know. You'll be pretty close. You might be off by, you know, 0.2. So. The first explanation was, sorry, the nerdy dietitian and me, where we like to break everything down.
Sorry, this is not a nutrition question, but I have a lot of difficulty trying to brush Aiden. He doesn't let me because of the sensitivities to, you know, he doesn't let me go behind. He also doesn't let me brush his front teeth. Is there anything we can do to make that easier? We use the electric toothbrush. In fact, I recently bought something which is like a 360 brush. It's like a, it just, yeah, it
Yeah.
just fits in and brushes. But I still find that it's not good enough or equal to what we would do brushing. So are there any ideas as
Is
how to overcome?
the electric one too much for him? Is it maybe too much input? Like it would be easier if it was just manual?
I do both. So mornings I do the manual. I do the 360 one, which kind of goes in like a denture, and then I floss. And then evening when he takes his bath, he also has his mechanical toothbrush, which he tends to do himself, but I don't think he gets everywhere with that either. So it's still a struggle.
Boss, the dentist will be happy.
He doesn't go to the dentist.
I won't tell the dentist that. Could you even, like, if it was just like a wet cloth, like just get in there, like just to get back there, because it's no input then, and it's just you kind of quick swiping. But he may be like that. I mean, and maybe some of these, how old is he? Okay. I know, I have a 28-year-old, I get it. Because I was like, if there's something, what if even like you started with the toothbrush on the outside, you know, and try to desensitize him this way, you know, or like I know sometimes even with feeding, what we've done is like there's, I have to show this. Right, just to do that, to kind of like prep him and get used to that, and just kind of like awaken the mouth, and maybe if there's a little bit more of like, oh, something's coming in, you know, like I said, we've done that with feeding, and sometimes the kids just tend to open up better for the spoon, but maybe something like that, or even just facial massages. I mean, who doesn't like a good massage, right? Maybe you can try it and see if he's, yeah.
Throw this out here because I think you said he likes like watching Thomas the Train and like iPad shows, and you're like a tech guy. I have seen like these apps where there's like fun timers on them, or like showing you like cartoon versions of where to brush your teeth. Maybe he would like to watch something and make it like an interactive experience.
That's a good idea too, yeah.
Would maybe help.
Distract him a little bit. I know. Yeah. Yeah, good question.
I guess I'm just curious to hear from families what their experience is getting medical foods. Is it an easy process for you? Do you wish it was easier? Is it through insurance? Is it through your clinic? Kind of, if you don't mind sharing. I know every state is different. Low protein foods or formula, I guess, whichever one, if it's not provided by clinic, what your experiences are.
For low protein foods, especially when they run out of protein and then they're like still ravaging. And we have like a specialty shop by us, which is extremely expensive, and they really dislike all of their foods. They find it very like plasticky or waxy. We have tried like the vegan versions. They don't like it. You know, like cauliflower pizza crust, they don't like it. So we have been, after 12 years, like very unsuccessful in finding anything except maybe stuff that they have eaten as a baby, like those like little puffs, or they have like, I don't know, they're called like little crunchers, and they look like baby Cheetos, but they're all, you know, nothing but filling up their stomach. But we have been very unsuccessful in finding anything that they think tastes really good and is low protein. And then formula, you know, we've just gone through this whole crisis. We're still in it because they take the Propionic too, and it used to be super easy. I would just call this wonderful man named Doug. I don't know who he is, and Doug, by some miracle, it'd be sitting on my front porch the next day. Sometimes I just call Doug and profess my love to him on his answering machine. I don't know who this man is, but I love him.
Do.
And then they took Doug Hart away out of the situation, and so now, you know, it's this whole process of getting it. So those are all my negative experiences. Sorry, I'm sure someone has some wonderful things to share.
Yeah. Right, right. Yeah.
So I'm in Illinois. For formula, we would get it through the DME, Apria, Option Care, whatever. We had a lovely guy named Steve, but that was the delivery driver. So if we had to sign for something, he would look for my car in the driveway, and if I wasn't there, then he'd circle back around later in the day. And then if I'm like, it's supposed to come, I don't see him, I could call him on a cell phone and arrange delivery. Low protein food, we never had any coverage. We just had to buy it ourselves. And we also did the baby food. Meyer package, you know those applesauce cups? They make baby food in those as well that don't look like baby food jars. So we'd use those. And then I really like the math. So I would modify recipes, like Energy has egg replacer. So we'd use that for pancakes and waffles and just do a regular recipe without egg and milk. So just a regular pancake recipe, flour, baking powder, Energy has, well then that's fine, you just add water or whatever. So it's a powder egg replacer that's made with like starches. And so you can substitute the egg in the pancake and stuff. I will find that for you. And then use rice milk or whatever for the milk part of it. And the other thing for cakes, it's a Weight Watchers recipe, but use a cake mix with a can of soda. So there's no egg or anything else added into it. But we would just kind of jimmy rig. Our hardest thing was nacho cheese. Because that's not what
Would it be helpful to like have a place where people could share recipes? Yeah, I was just wondering if that's something that maybe.
So
Look into?
FYI, the PKU Board of Illinois, there's a wonderful mother who is back on, and she and another mom and myself and my designer are going to be doing email recipes, newsletters. So watch their website, join it if you want. And we're having cooking classes this year as well. So, I mean, if you join on to that, the PKU Board of Illinois, then we'll do, and Kim is like amazing cook. The idea she has is just mind-blowing. And it's not always the low protein things. So for those who don't like it. You can, right. Do we, we need to put the, I can get it to Jill. Maybe we can put the link on the, you have it?
The table in there, it has like a list of their events for the year and a link. But also, for those who aren't aware, Cook for Love, it's a PKU website, but it has tons of recipes also that are low in protein.
Mm-hmm.
And there's even a Facebook group that goes in connection. It has PKU in it, but I'm in it and I have home Aciduria. There's other
Right.
vitamins, MMA.
Right.
So I would highly recommend checking out that website because there's so much stuff. And the pancakes on the Super Love website, everyone in my family will eat those at Christmas and holidays. They don't know the difference. They fluff up, they're golden, they're beautiful. So,
Yeah.
you know, I think super family have to make it one.
Right.
On the medical formula in Missouri, we're doing the private insurance, and what I found is with the PA or MA, they'll cover the powder under the insurance because there's no diet for a PA or MA kid. But some of my coworkers have PKU kids, and they're almost screwed because insurance says, nope, PKU kid can go to the grocery store and eat, so we're not helping you in any way.
I did not. No.
I think it's a struggle for families because there's no uniform coverage of formula or medical food or low protein food products in the United States. So I just think it's so important in terms of how we vote and how we can make our legislatures aware of the situation that so many families face across the United States. And I think organizations like this that bring all the families together are a great way to unite and make the voices heard. That I think we really need more uniform national coverage of these items so everybody can benefit. Yeah.
So there is actually a bill that has been introduced multiple times into the House called the Medical Nutrition Equity Act, and it would mandate insurance companies to cover medical formula and low protein foods. Sarah, who's doing FLOC, is also, that's one of her many initiatives along with other patient groups. But they need patient stories. It's a lot of PKU families, but we also need families with MMA and PA also to share their stories on the site as well. So it's nutritionequity.org. There's a place to contact your congressman, tell them to co-sponsor the bill, but also to share your stories, because, you know, just because there's access does not mean there's access actually to these vital things that our families rely upon. So.
The other thing is our kids would qualify because of disability when they're in the school system. Under USDA legislation, the school has to provide them a meal that fits within guidelines for the same cost. So that would be breakfast as well. So we did twice a week. She had hot lunch and we had specific items. Sometimes the elementary school might have pizza and it's lower protein than the high school or the junior high. So then they would move that, or the cups from Meijer or Trader Joe's that has low protein items. And of course, never telling them they had to take a milk, you know. But then they did that and we worked with Airmark or, you know, whichever vendor was that at the time. They didn't write it into her IEP because it's an accommodation with the USDA, but they did provide that, and I met with the lunch managers a couple times a year.